Some people come to our office begging for a medication. Other people come and say, no way, I'm not doing it. But most people fall in the middle, kind of wanting to know more about the options they have, whether it be medications or supplements. Here's the thing, medications and supplements can really help dogs to feel calmer and feel happier without changing their personality in a negative way. So let's go through some of the frequently asked questions that people have when they come to my office and we talk about supplements or medications. First and foremost, people want to know, will their dog be a zombie? No. About 25% of all the people in the US are on some type of psychotropic medication to help them get through their life. We don't have 25% of our population walking around as zombies. Of course, we don't want your dog to be a zombie. I think what people are referring to is that some medications can cause sedation as a side effect. But the cool thing about psychotropic meds is if your dog is sedated, you just decrease the medication or take him off and the side effect goes away. Sedation might be a side effect, but it's one we want to avoid. Okay, number two, people want to know if using these medications are going to shorten their dog's life. How are they affecting the kidney function or the liver function? I want you to know that these medications are safe. The medications we use in dogs have been approved for use in people, so we know a lot about them, and some of them are approved for use in dogs as well. We start dogs as young as 4 or 5 months on some of these medications and follow them out through the rest of their lives. So there's a big safety factor with the medications that we use. People sometimes want to know, is a supplement is right for my pet or if a medication is the right answer. So here's the thing. Medications will probably give you about a 50% change, although there are some studies that show that particularly for noise phobia, you might get more like 69% change, okay? Supplements probably are gonna give you about a 25% change. Of course, it's individual and you might get a miraculous result, but we wanna have realistic expectations of what these medications and supplements can do. How can we boost that percentage of decrease in target behavior? By adding in avoidance, management of the environment, and also behavior modification. That's how you reliably get up into the 85–90% reduction in target behavior. So how will you know if a medication is right for your pet? Because one size does not fit all. First, think about how quickly your dog goes from 0 to 60. If your dog goes from 0 to 60 in a second, probably some type of medication or supplement would be helpful for him. What about his quality of life? Can he not do doggy things? Does he like to dig holes and then lie in them, but he can't because he's too afraid to go outside, because he's too afraid of noises? His quality of life is being affected. Is someone at risk because of your dog's behavior? Is he biting someone? Is he a risk to someone in your family or outside your family? Is he a risk to himself? Is he licking, biting, chewing, self-mutilating? Or are you considering that you may not keep your dog in your family? Please consider a medication or a supplement to help your dog. Think about your environment. Is your environment conducive to helping your dog? If you are a busy working family and you have several little ones, toddlers in the house, it may be really hard for your dog and he might need a medication or a supplement in order to get through that time period till your little ones kind of grow up a little and the house calms down a little. People ask how long their pet will be on a medication. Your pet is going to be on a medication, if it works for them, 6 months to infinity. Look, lots of people don't want to take their dogs off the meds because it's helping their dog. Their dog is happy. Their dog is not more unhealthy because of the meds, and that's okay. I don't have a medical reason to take these pets off. When you're ready to take your pet off of a medication, you're simply going to talk to your veterinarian about it and decide how to do it so that you can make sure that your dog's behavior does not relapse. Consider a supplement or a medication for your pet and go and talk to your veterinarian about it. If you feel like your pet's quality of life is affected or your quality of life is affected by your pet's behavior problem.